Hello, this is a reflexology hand procedure, right hand. Cleanse and examine the foot. Everything we see on the hand which concerns us, we put on the reflexology health record. Okay, this hand doesn't look like it has any problem. So after cleansing, we start from warm-up. Warm-up starts from palmar dorsal, because the area we work is from the pelvic. This is the pelvic. This is the lower abdominals, upper abdominals, thoracic, and the head. Head, all the fingers. Okay, so let's start. Palmar, dorsal, back and forth. Rub from wrist to the end of the fingers. Vigorously, vigorously. Knuckle draw, knuckle draw. Start from the wrist, over pelvic, over both abdominals, lower and upper abdominals, thoracic, and over the head. And draw down. After knuckle draw, we do the wrist rotation. 360 degrees in a circle motion, to the left, to the right, the same. Thoracic stretch. This is the thoracic area, so we stretch downwards, we stretch upwards. Then we press the solar plexus in, that's the thoracic, that's the diaphragm, zone 3. We press, we go, we push up, rotate 3 times to the left, 3 times to the right, and stretch to the side. We do it 3 times. And then we do the longitudinal zoning starting from the wrist area, zone 5. That's the longest procedure in the warm-up techniques. So we go just once, every one zone. We don't have to rush. We can spend some time on that. After doing all the 5 zones, remember, as we've done on the feet, we do 5 zones of the thumb. So zone 1, zone 2, zone 3, 4, and zone 5. We stay on the thumb and we press the pituitary gland, cross lines. Press, 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 rotate, rotate, stretch to the side. That's the hooking reflex. That's all hooking reflexes, how we do that. We press in, we try to push up, rotate both sides, and stretch to the side. Then hand clean out, because the warm-up procedure is done. Now we proceed to spine reflex. Spine reflex starts from tugging gently the thumb and working thumb. Working thumb, we can go this way, longitudinally, twice, and it's good to go both ways, up and down, and then we can pinch vertically, horizontally. That's the spine reflex. So now we come to the anterior forearm pelvic area. We grid the pelvic area. So we grid it once, going through all zones, starting from zone 5. And going vertically, we use the thumb. Going horizontally, we can use 4 fingers walk. Below wrist work. Okay, and now would be palmar, sorry, it's zone 5 below the wrist. We work the hip lower back sciatic, and we combine points here. So after finishing the hip lower back sciatic in zone 5, we press the ovary testicle point on top of that line, and then we go up above the ovary testicle, pressing sciatic point reflex. So hip lower back sciatic, ovary testicle point, sciatic reflex above the ovary. Then we can use, coming to zone 2 and 4, as we remember on the foot we have the pinching reflex on the Achilles tendon. The same comes here, and this is sciatic rectum reflex. We can pinch, or we can use separately thumb walk, or thumb and finger walk. So your choice to use different techniques. And now we come to the to zone 1, large colon reflex. It's below the wrist up work. Also combining reflexes. It's the UVPP reflex. You can see the reflex, it's in the little indent above. And here also we have the anus, rectum, testis, and hemorrhoid reflex. The hemorrhoid reflex comes from zone 1 to zone 3. So we go like, we work that a large colon reflex. We finish with pressing the UVPP, uterus, vagina, penis, prostate, and then we go across working the hemorrhoid reflex. Zone 1, 2, 3. After finishing the zone, the pelvic plantar, we go to dorsal. We go to the dorsal, and we can work it also walking 4 fingers like that. And this way we are covering fallopian tube, groin, lymphatic reflexes, zone 1 to 5, gridding always above the wrist. Above the wrist is the fallopian tube, lymphatic, groin. Clean out both the dorsal and plantar area. And now we come to the zone 5, leg and arm reflex. Zone 5, leg and arm reflex. Pinch this reflex. From the indent here, from the hand, right? When the wrist finishes and the hand starts, then we pinch that leg and arm reflex. We can go across using all 4 fingers and just working the lower upper abdominals, hip, tiny, elbow. Visible. And then we have the sciatic reflex on the side. So press it. It's not that easy to find it. We have to use our intuition, kind of, to press the sciatic. So press it and slide down. Press it, slide down. And then we come to the shoulder reflex. You can use 4 fingers, you can use 3 fingers, or even 2 fingers. It's easy to overlap. I use all my 4 fingers also, the same way as we did the hip tiny elbow, we do the shoulder reflex. The other thing is that we can approach that from the top to cover vertically. So horizontally and vertically. Okay, so now we can clean out and we go to the palmar lower abdominal area. On the right hand we have, so we start from zone 1. No, we always start from zone between 4, 5 now, because it's the colon, the large colon here. So we go up. We are doing the ileocecal, the appendix, up, up, up. Then we have the hepatic flexure, and then we go across. Over zone 1, the transverse line. And we just grid the whole area. Grid using, you can also use like 4 fingers walk here, if it's convenient, covering the lower abdominals. We also have here those reflexes, like we also have here the uterus, the ovaries, and the fallopian tube, right? So we can use both hands to work those. Uterus, ovaries, fallopian tube. Clean out this area and proceed to upper abdominals. We always can stretch, that also helps us and the working hand to relax, to feel more comfortable. So we start from zone 1. At the zone 1, at the base of the thumb, and here we have the uterus, ovary, no, that was below. Now we have the duodenum, stomach, pancreas, duodenum, stomach, pancreas. We also have kidney. The interesting thing about the urinary system here is that the bladder, you can find the bladder below the thumb, but you don't have to go in a curve. You just go up, 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 up along zone 2 and press the kidney reflex, the kidney, the adrenal, kidney, adrenal, kidney, adrenal. Then we can grid the whole area up until the diaphragm line. Gridding this area. Always include the thumb. So this is the palmar upper abdominal area. We cover duodenum, stomach, pancreas, zone 1. On a thumb, thumb is esophagus, thyroid, parathyroid, mouth. And you don't forget we have the liver here in zone 5, 4, 3, and 2, gallbladder. Clean out the upper abdominals, and then we do the chest stretch. And we work horizontally across the diaphragm, and we can press the solar plexus, zone 3, in, up, and across, in, up, rotate, and across. Working the thoracic, easy, using 4 fingers. I usually work 4 fingers overlapping the other areas. like that. 3 fingers works too. You can also use the knuckles vertically. So horizontally fingers, knuckles longitudinally. Now we clean out the upper abdominals and working the dorsal lower upper abdominals, use 4 fingers walk from the wrist, from the beginning of the hand, and work with 4 fingers. Actually start from zone 1, work like that, covering all the dorsal, lower upper and thoracic, and we combine thoracic here too, and then across. And now back to the palmar head area, right? Before the head we have the neckline. Working neckline, I like to do it this way. Press in between each finger. That feels so good. And each finger would be worked separately. So just tuck the all fingers lightly, pulling up. So this way you are working, pulling and working reflexes like teeth, both sides, ear, up, sinus, and the brain. And we can also approach from the sides, lateral and medial. That's important because it feels a lot better. So the same do with each of the other fingers. Pinky, ring finger, teeth, ear, sinus, brain, middle finger, teeth, eye, sinus, brain, and from the sides. Pulling up. Teeth, eye, up to the sinus, brain, and from the both sides. Always include both sides. And here the same we do, tugging the thumb, working the middle part first, covering the teeth, covering the sinus, covering the brain, then the sides. And then we can separately use all the reflexes. So we start from the tonsil on the side, tonsil on the side. On the other side we have the mouth, a little above the tonsil. So then we go back to the medial side of the thumb and press between zone 1 and 2 hypothalamus, the important homeostasis point. Then we go to the other side to work the nose at the base of the nail, work the nose, and back at the base to the medial side of the thumb we work the pineal, and then we finish with pituitary gland. So now we just clean out the entire hand, and we just rotate each finger separately, pulling 360 degrees both sides. So right hand is completed. Now we can proceed to the left hand. Thank you.